because so we can share it out to other restaurants and stuff. But we do have a tight schedule today just because we have webinars all day on this. So let's go ahead and get started. I know this has been a challenging time for all of us, and one of the things that we wanted to do as a chamber is partner with our Health and Human Services department here in the county and provide you guys a smart restart playbook. Hopefully you have been have had a chance to look at that because it's very business specific. And please note that the information will change probably as the governor releases new information and all that kind of stuff. So it will be up to date. But on the phone call today, we have Suzanne Wright, who is with the Davie County Health and Human Services. She's our director. And then also we have Luann Angel, who is our public health nurse and communicable disease for Davie County. So we're going to go ahead and get started. I'm going to pass it over to them, and I'm going to be sharing my screen with you guys so you can follow along.
Hey, good morning. I want to thank Caroline and the Chamber for including us in this opportunity to support local businesses as we navigate a pandemic and really new ways of getting our work done. And I also appreciate you taking time out of your schedules to participate in these calls because it shows that you care about your business, your staff, customers, and basically doing the right thing for all. The Chamber Smart Restart Playbook provides great guidance and a framework for building a protective environment that staff and customers can appreciate and feel comfortable in. And I think that's going to be the biggest thing because some people are comfortable now, others it's going to take time before they get comfortable. And today we just really want to provide suggestions for your use and answer any questions you might have. And like Caroline said a minute ago, we have Luann Angel with us. She's one of our public health nurses. She's been doing communicable disease for at least 23 years here in Davie County. Her husband's a business owner, so she knows firsthand how people have been affected. And I know that she has been talking with businesses over the last 2 weeks and looks forward to sharing additional information with you today. So at this point, I'm going to turn it over to Luann.
Good morning, everyone. Can you hear me okay?
Yes,
ma'am.
I'm happy to be on the call. Thank you, Caroline and Suzanne. And the Smart Restart for Davie Playbook is great. It should be able to assist our businesses in reopening. I want to thank everyone on the call today and kind of echo what Suzanne said, but especially thank you for your sacrifices that you have made to protect you, your families, your employees, your clients, your customers, and the residents of our county. We appreciate your diligence in following guidance and orders. We know you're anxious to reopen, and we hope today's discussion will benefit you to prepare to safely get back to business. Caroline has the page up that starts the section on food service. I'm going to just you don't have to change the page, Caroline, but back at the beginning between pages 4 and 13, there's important safety recommendations, tips, communication with your team, preparing your space, just lots of good things that would apply to every business, no matter what type. But for this session, we're concentrating on covering food service sections. To begin with, I would like to ask the people on the call if you have been totally closed or if you have been open for everything but dine-in, open for drive-through, takeout, or delivery.
Mock has been closed since the 16th of March. We have slowly reopened to employees this week, but plan on a full opening June 1.
So part of this will apply to you, and I see that Kip's on the phone, and I know you have been open for takeout. One thing to think about if your business has been completely closed, if your building has been closed, to ensure proper operation of your building systems prior to reopening. When buildings are closed and you have a reduction in water usage, it can cause stagnant or standing water in the water system. That can increase the risk for growth of Legionella and waterborne pathogens. So taking steps to assure that your building water and your water system are safe. Same goes for the air quality, replacing HVAC filters, cleaning or disinfecting existing filters, and then increasing your ventilation by opening windows or adjusting air condition. Prior to opening, sanitizing to limit the spread of germs. Limit the number of workers. It's advisable to do that during that time. To sanitize and disinfect all areas with special attention to food prep, workstations and equipment, restrooms, common surface areas, electronics, all seating, tables and chairs. On the CDC website, there's guidance as to what type of sanitizers and disinfectants to use, what's safe. Something that's new for everybody is educating your staff and reinforcing the need for protective measures that they're not accustomed to in food service, like wearing a face mask or face coverings when you can't have 6 feet of separation. Plan ahead on these supplies for your employees. Face masks and coverings protect others from the wearer's potential germs. And there's nothing worse in the food service industry than an outbreak of illness being linked back to a particular establishment. Gloves should continue to be used in food preparation as before. However, caution employees that gloves do not replace the need for frequent hand washing. Wash hands often with soap and water at least 20 seconds. If soap and water aren't available, then 60% alcohol-based hand sanitizer. And reminding people to avoid touching your eyes, nose, mouth, and face with unwashed hands. Wash your hands after you touch your face. You have already sick policies for your employees. Employees who have a fever or otherwise are exhibiting symptoms of COVID should not be allowed to work. Some businesses that have remained in operation, not just in the food service industry, do a symptom checklist and take temperatures at the beginning of a shift for their employees, and then make sure that your employees are aware of your sick policies and stick to them. If an employee becomes ill while they're on their shift, we'd recommend not allowing them to continue working. If they have to wait on a ride home or to go to medical care, have a designated area for them to wait safely, and so that they don't expose others. In addition to COVID, it's just being sure to protect against GI illnesses. When I made the comment earlier about outbreaks of illnesses, that's something that food service industry has to think about all the time. There is guidance for return to work after COVID. We have certain guidelines that we can release somebody from isolation if they have been sick. Most businesses go beyond that and have them stay out for 2 weeks from their onset of symptoms. That's something that you would need to make a decision up front so that you have something in place that you're ready to inform your employees about. Signs can be posted at the entrances that individuals who have a fever, cough, shortness of breath, or other COVID symptoms should not enter. There's lots of printable signs available on the CDC website, and encourage your workers to report any safety and health concerns to you as the business owner. In setting up, this is probably going to be the biggest thing, in setting up to reopen is remembering social distancing. We, at this point, don't know the exact constraints that will be placed on capacity during phase 2 of the governor's plan for reopening. However, you have to remember the 6 feet apart rule. Position dining tables to maintain social distancing. Limit no more than 6 guests per table. Indoor and outdoor waiting areas should be marked to maintain social distancing. Think about your high traffic areas. Position tables away from entrances or exits to food prep areas. If you have a bar, consider serving bar patrons at tables to maintain social distancing. If you do seat people at your bar, think about the distance between them and the bartender, and think about the distance between them and the next patron down the bar, and trying to limit that. And thinking about bussing tables, limiting the number of persons that do actual bussing of tables. They're going to be the ones who are going to handle the used dishes and utensils and things the customers who come into your business who could be sick with COVID. We have had cases that tested positive and had no symptoms whatsoever. They were tested because of travel or contact to a case. So we know that that can occur. So we can't always, can't look at somebody and know, yes, they have it or they don't. There are tips in the section on food service about creating barriers so that you won't lose booth space. If you can create a barrier between those with a partition or something above the back of the booth, then that would be okay to use it that way. Thinking about contactless transactions, limit the cash that you handle, encourage customers to use contactless forms of payment. If your servers use trays or the little folders to put the patron's check in, those should be cleaned every time. It may be better not to use those at all. Sanitizing your point of sale equipment after each use, and something you may have seen in grocery stores, and those who are open for takeout may be doing this already, but covering your electronic payment terminals with some type of plastic that can be cleaned. Those of you who have continued to operate with pickup and delivery services have probably worked out the safest ways to do this already. But there are multiple tips for cleaning, food safety, social distancing, and no-touch deliveries on the page 43. They are on that page that's up right now of the playbook. That's a lot of information in a short time. I know we're pressed for time, but now we would open it for questions, or if you want to share best practices of what's worked for you.
Kip, I'll go ahead and say, do you have any questions?
Can you hear me?
We can.
Oh, okay. I wasn't sure. This is the first time I've ever done this. So anyway.
You're doing good.
Actually, I do. What about like cleaning your tables and all? Does it need to be a separate towel or, a disposable, or can you use the sanitizing with the just the regular bar towel, which we used to use, or does it need to be a separate thing that can be thrown away, or you can put it back into the water like we've always done, the sanitized water?
Luann?
Can you hear me now?
Yes.
Okay, sorry. This is new for me. Kip, are you using a Clorox and water solution with your bar towels?
We are, yes. That's what we've always done. But right now we've also got squirt bottles, that we use that are restaurant approved that we've ordered, and but we still use the towels. So we use just the disposable towels here lately. But I didn't know if that was a go or not a go on that.
Probably the disposables would be the safest to use.
Okay.
But certainly if you use the other and you're diligent as you clean the table and they have time to soak before you take them out and use them on another table, just dependent upon if your business picks up and your staff is busy, those disposables may be the safest, less chance for error.
Okay.
Another thing to think about is not using condiments not having condiments sitting on the tables. Either when patrons request them, put them on the tables and sanitize them afterwards, or using disposables.
Okay. That was actually another thing that was on my mind too. So that's good. Okay. I mean, what if you were to like we've actually ordered a lot of caddies, to put on the tables. What if we have some that we can swap out and sanitize them in between each customer?
Certainly, that would work. Yes, just getting your staff into that routine of doing that would work.
Okay. And one more question. I don't mean to take the floor here, but one more question. What outdoor seating, when they get ready to do that, and I know it's still got to be 6 foot apart and all that, but will we be able to set tables outside? Of course, we've got a patio on the back, which I'm sure there's no problem using that. So I didn't know if we needed additional tables, if we could put them out there, space them 10 foot apart, in the parking lot, sort of like what we did before when this thing first hit. We put tables out front, and that lasted about 3 or 4 days, and then of course you had to take those down, which I understand that, but I didn't know since it was phase 2 if that would we would be able to do that again or not.
That's
Possibly
something that we can't really answer, because that's going to be in the guidance that comes out from the governor. That and your capacity that would be allowed inside for dine-in.
Okay. Well, that's helpful then.
Kip, do you have any other questions?
I probably do and can't think of them right now.
Okay. Well, we have time.
But
We have 15 minutes. So if you think of something, go ahead and ask. At this time, I'm going to turn it over to Bill. Do you have any questions, especially with catering and, with you being an event venue, you might have some more specific questions.
No, I think she answered most of the questions. I think Wayne and I have been kind of on top of this, trying to create a document for our employees, as well as a document to give out to guests on request and or clients. A little of my background, Miss Wright and Miss Angel. I spent 25 years in the restaurant business as an executive chef and ran a catering business. So everything you're saying plays into all of that. We are actually going to the point where we are going to be taking temperatures, at least during this phase 1, possibly phase 2, taking temperatures of all our guests on arrival. We're going to suggest that they use masks, which is going to be a challenge, obviously, with weddings. But we have we're using a quat-based sanitizer, not chlorine bleach. But we have a set protocol, not only on days like today when no one's there, but during an event, we will have at least one person dedicated to wiping down all high-touch surfaces. Our bartenders will be wearing gloves, which they'll be changing out at least every 30 minutes. Because as you said, I believe, or I read this morning somewhere, the problem is people in the restaurant business or in the catering business think the gloves are, they put them on once and then don't think about it again. So we've gone to a very static cleaning regimen and or glove wearing regimen. We've got a 6-page document for our employees, so I'm hoping that we've sort of covered everything.
It certainly sounds like you have covered everything. And the big thing is that educating your employees, getting them started off on that right foot.
Absolutely.
So,
Luann, I'm sorry, don't mean to. Go ahead. I'm sorry.
No, go ahead, Kip. You're good.
I was going to ask Luann, as far as like menus and things like that, should we just go to disposable menus, just paper menus? That way we can throw them away every time, or, wipe them off in between, or, what do you recommend there?
Wiping menus in between customers, if you're using plastic covered menus, or
That's
paper
what we
menus
have, yes.
that are disposable. Either one would be acceptable.
Okay. Because we've also ordered a thermometer, also infrared thermometer. I guess that's what it is, to check, employees every morning when they come in. We haven't gotten it yet, but it's supposed to be here this next week. So hopefully that's going to help us too. Made a good point on that. Is checking it'd be hard to check guests, and all that, but employees we can check. They'll have to be checked every morning, before they even clock in. So.
Something to add to that is just doing a symptom checklist. And when this all started, our primary symptoms we were looking for were fever, cough, and shortness of breath. The CDC has actually expanded that. Some people have had sore throat, headache, flu-like symptoms, muscle aches. Some people have even had GI symptoms without the respiratory symptoms, nausea, vomiting, or diarrhea. So those are things that you're not going to let your employee work if they're having those anyway, some of those. But
Oh, absolutely,
a
absolutely.
symptom
Yeah.
checklist, there is one online on the state website for employees, and it's just like a symptom screening that they can run down the list when they come on shift. Might be helpful.
Okay. Yeah, we've done that because we have been open the entire time. So it's one of those that, you know, we've kind of, you know, I mean, you ask, you know, but that's all you can do, you know. I mean, you ask them, you know, how you feeling and all that. And we've had a few employees that, you know, just they're, you know, the older, you know, 50s, 60s and all, you know, who really didn't want to return to work, which, you know, has been fine because we've had plenty of people to cover it. But, you know, when we get back, we're going to, you know, make sure that everybody's good to go and, you know, make sure there is no symptoms or anything like that they've had or even had in the last, you know, since this has been going on. So, okay. Well, that answers a lot there then. Okay.
I do have one
we have
legal question.
Seen with other businesses, sometimes employees may feel uncomfortable saying, I don't feel well, and you know, and they feel fearful for their job. I know that's not happening with you guys, but that is a situation that we've seen in different types of businesses, all different types of businesses. But just being open, making your employees aware that they're open to discuss it with you. If they're afraid, like you said, Kip, the older employees that you have may not feel safe working, and just, you know, consider that working around those kind of situations.
Right. That's what we've done so far. You know, we're going to give them the opportunity if they're well to come back. If they're not comfortable, then, you know, that's their call. That's not ours. So, yeah. Okay. All right.
Okay.
All right. We have Luann. Bill has a question for you.
Okay.
And we've gone back and forth with this, Wayne and I have. Is there any legal obligation if a guest arrives, we take their temperature's 100, 101, are we legally within our rights to keep them from coming in the building?
That would be up to your policies. If you adopt that in a policy and you make sure that people are aware of that before, for instance, if it's a catered event and a wedding,
right,
that they are aware of those type rules beforehand. I mean, it's your business, and I feel like, you know, you can make those rules, but the in thinking about legalities is just making sure they're aware of them ahead of time.
Right. Okay. Thank you.
Okay. So if there's not any more questions, we'll go ahead and close out this session. Thank you so much, Luann and Suzanne, for joining in on the call. Also want to note that they are available for you guys at any time. So Bill, if you want to send over your document, I feel sure that Suzanne and Luann would look at that and review that for you. But also, if you're wanting them to do any kind of walkthrough via Zoom, they'd be more than happy to look at your place, the different restaurants and stuff, and provide you good feedback or areas that you can improve. So, you know, they're here. We are truly blessed to have them in our community. And thank you guys so much for joining us. And we'll be sure to send out this recording to you by the 1st of next week.
Thank you all.
Thanks.
Yes, thank you very much. That was informative. I appreciate it very much.
Thank you guys. Have a great day.
Bye-bye.
Thanks. You do the same. Thanks. Thanks, Caroline.